Welcome to Wednesday's edition of COVID-19. In a span of 4 days, Korea's daily tally has surged past 500 cases yet again. Now, this is a worrying uptick that is being witnessed in many other parts of the globe, despite the rollout of vaccines and amid continued reports of long COVID. Now, we have details later on the program. Here now are the pandemic updates with Kwon Soa. Now, Soa, here on the local front, how worried should we be?
Well, Sunny, the highest number of COVID-19 infections in 40 days was reported this Wednesday, with 506 infections reported as of 12 a.m. And that also includes almost 500 domestic transmissions, with 15 cases from abroad. So Korea's total tally now has surpassed 103,000 with 1,731 fatalities, but also the number of recoveries has hit over 95,000. Now, the metropolitan area accounted for almost 300 infections. We'll take a closer look later on, but here on our graph, we can see that twice in the past week, we had numbers above 500. And now let's check our map. We have almost 300 cases in the capital region, but also outside the capital, we are seeing resurgences, especially down in Busan with 58 infections. And as authorities have been mentioning almost on a daily basis, with the warmer spring weather, more movement is happening across the nation, which is also why many spring flower festivals are being held online or with a limited number of visitors at intervals, including the Yeouido Cherry Blossom Festival, where roads have been closed this Wednesday, a day earlier than was scheduled. Meanwhile, this Wednesday, authorities have announced stronger prevention measures at childcare facilities, so educators will have to get PCR tests once a month beginning in April. And also some of those educators will start to receive their vaccinations next month. And so far, over 852,000 people in the nation have received their first shot of vaccinations and more than 8,100 their second dose.
Right, and so I believe the World Health Organization has released its report on the origin of the COVID-19 virus. What was on that report?
Well, Sunny, more than a year after the first COVID-19 infection was reported in China's Wuhan, an international team of experts presented a set of theories and on how the virus spreads to humans. They are suggesting wild animals could have been the source, so not a seafood market, but farms could have been where the pandemic has started. They are saying, however, that further studies are needed, and there were some issues or difficulties with accessing data.
In China, like in many other countries, there are restrictions on and privacy laws that forbid the sharing of data, including private details to outsiders, in particular if the data are moving out of the country.
He added that political pressure was felt, but that pressure did not force them to remove critical elements from their report, stressing that all scientists stand behind the results. A group of 14 countries, which includes South Korea, the US, and Japan, have raised concerns over the report, saying it lacked access to, quote, complete original data and samples. And now let's also get a check on the global figures. We are seeing resurgences here with over 550,000 new infections in a day, and also more than 11,000 people who have lost their lives due to COVID-19 in just a day. And if we take a closer look here, there are concerns in the US at 31 million cases, where around 40% of recent cases were said to be the variant. Meanwhile, Turkey here has surpassed Spain in total numbers of infections. And now for a closer look at the daily increases, why don't we start with Turkey here? Over 37,000 new infections in just a day, and serious resurgences in Brazil with more than 86,000 new infections. And those are the updates I have for now. Back to you, Sunny.
All right, so thank you for now. Right, here in Korea, efforts continue to keep the country's inoculation campaign on track. Now, for more on these efforts and others, I have Kim Han-il in the studio with me. Welcome, Hanel.
Good afternoon.
Right, I hear another batch of Pfizer vaccines has arrived here in the country.
That's right. Pfizer vaccines enough to inoculate 250,000 people have arrived at Incheon International Airport this morning at around 8:20 a.m. This, if we add this together with the batch of Pfizer vaccines that arrived last week, this is enough to administer 2 doses to 500,000 people. People aged 75 and above will be receiving these shots starting tomorrow. The government currently plans to bring in enough Pfizer vaccines for 3.5 million people by the end of June. Among the remaining 3 million to be delivered over the next 3 months, around 1.4 million are set to arrive in April and May. However, whether the government can meet the June deadline for the other 1.6 million vaccines remains uncertain amid the global supply crunch, especially in Europe and the U.S.
Right. Meanwhile, Hanel, authorities here have revealed intentions to front-load their vaccines, I hear. What does this mean?
Well, according to a top Korean health official, this means that the government is reallocating a part of its AstraZeneca vaccines intended for second doses to hand out first shots to more people. Take a listen.
We are administering more first doses to the elderly aged 65 and above at nursing facilities, having repurposed vaccines that were originally planned to be given out as second doses from our initial shipment of 790,000 AstraZeneca vaccines.
The official said this will not lead to any major shortage of the vaccines, as more shipments are due to arrive in the coming months. The move comes as the government looks to increase the number of first-time vaccine recipients as quickly as possible in case of future disruptions in the global vaccine supply chain.
We are exerting our full efforts to fast-track our June vaccination schedule for all medical facilities, looking into ways to make vaccines available to more people as quickly as possible.
Medical experts say that getting 1 dose of the vaccine is still better than not getting any. For AstraZeneca vaccines, the government revised its recommended interval between the first and second doses from 8 weeks to anywhere between 10 and 12 weeks. Patients might have to wait a little longer for the second dose in case of contingencies in the global supply chain. But 12 weeks is still within the manufacturer's recommended time frame.
I see. One final question, Hanel. I believe world leaders, including President Moon Jae-in, have called for a coordinated response to pandemics. Tell us more.
Sure. So President Moon Jae-in, at the request of the Director General of the World Health Organization, contributed to an opinion piece on Tuesday, along with the leaders of around 20 other countries. The article, which was published by numerous media outlets, called for unity in building a more robust international health system. And world leaders pledged to work together on a new international treaty based on current health norms. The piece emphasized that the new treaty should mainly focus on pandemic countermeasures at local, regional, and global levels. With this new treaty, world leaders hope to better predict, prevent, and respond more effectively when the next pandemic hits. The treaty also involves the concept of One Health, which connects the health of humans, animals, and the planet. They wrote that such a treaty must be guided by solidarity, fairness, transparency, inclusiveness, and equity. In addition, the WHO chief gave high marks to Korea's COVID-19 countermeasures and its cooperation with global bodies to provide test kits. The Blue House responded by saying that the Korean government will continue to cooperate with the international community to achieve a tangible outcome in this regard.
All right, Hanel, as always, thank you very much for that report.
Thanks for having me.
Right, elsewhere around the world, in a show of solidarity against anti-Asian violence amid the pandemic, Pixar is sharing 2 short animated films by Asian American directors. I have one of them joining our show virtually today, Edwin Chang, the director of Wind. It is a pleasure to have you with us, Edwin.
Thank you so much for having me.
Right, Edwin, please start by telling us a bit about the plot of your film, Wind.
Sure. Wind is about a grandmother and boy trapped in the middle of an endless chasm. They live on top of massive boulders suspended by the wind surrounding them. And in order to escape this place, they scavenge the debris around them to try and piece together and build a rocket. It's inspired by my own grandmother and the sacrifices she's made for my family.
I see. Now, I believe, Edwin, the film was actually released back in December 2019, but it has recently been gaining much attention amid the rampant racism against Asians in the US. What has been the public response to your film?
It's been amazing. It's been really wonderful to see reactions to people who were touched by the film, saying it reminded them of their own grandparents and the sacrifices they've made for their own family. And in particular, I've been really heartwarmed to see it connecting with people across many different cultures and seeing that thread of grandparents and the love they have for their families being shared by everyone.
Right, of course. Edwin, what can you tell us about Pixar's decision to let your work reach a greater audience online, free of charge, of course, amid this pandemic?
Yeah, well, at Pixar, we know how important storytelling can be to help people be better understood and help people view each other more fully as real people. And a film like this, which features Asian American characters, in particular an Asian American grandmother, who have been the targets of many of these attacks, we really felt like this was one way we could make a difference and help people build empathy towards the Asian American community.
Right, and speaking of those attacks, as a Korean American yourself, what are your thoughts on the hostility targeting Asian Americans in the US?
Yeah. My first reaction was one of confusion and sadness. I've lived my whole life in the US and viewed as my home, so to see these attacks happen, especially against our most vulnerable group, the elderly, people who remind me of my own grandmother, was really horrifying. And as time has gone on, though, I've seen the Asian American community band together and respond to this, and that's changed into a larger feeling of solidarity with the community as a whole. And as we work to confront these issues and make ourselves more visible in a society that's often made us feel invisible, it's been really heartening to see us building ground and speaking out for ourselves.
Right. Edwin, what essentially is the message that your film seeks to share with its audiences?
Yeah, the main message of the film is really just to recognize the sacrifices our families and our grandparents and grandparents have done for us, and really thank them and appreciate how much privilege we have at this point, just to the amazing work and love we've been shown by our families. And beyond that, it's really showing that this isn't something that's just limited to Korean Americans or Asian Americans or even grandparents and parents, but something larger as a whole of the families and the love they have for each other. And showing just that while we have this in our communities and that kind of sentiment, it's really shared across everyone, and that we all have the same kind of respect and love for our grandparents in that way.
Right, that is so true. Edwin, I hear you've been working at Pixar for 15 years now. How has the pandemic affected the animation industry?
Yeah, many things have changed, and just like the pandemic, continue to change, and so we're still really navigating that solution. But in particular, our last feature film, Soul, was originally slated to be released in theaters in the US, but was instead shifted to being released on the streaming service Disney+. And likewise, our upcoming film, Luca, will be doing the same, going to Disney+ instead of theaters. But we're looking forward to theaters reopening again and plan to return to feature films being released in that fashion. But at the same time, streaming services have grown so much, it's proved to be a great opportunity for new stories and new content. And we're currently working on a new series called Win or Lose, which I'm currently working on, which will be released in 2023.
I see. Well, best of luck in your new project. And Edwin, thank you very much for making the time to join us live with your work and your thoughts.
Thank you so much for having me.
Right then, come Thursday, Korea will kick off its second quarter inoculation drive with senior citizens aged 75 and above on its list, as well as nurses at schools and staff members at special education facilities. Now, given the expanded group, there appears to be more questions about the safety of COVID-19 vaccines. Will we address a few of them in this following report?
The second phase of Korea's vaccination program is set to kick off on the first day of April, with the government planning to administer at least one dose to a total of 12 million people by the end of June.
국민들께서도 백신의 안전성에 조금 더 의심을 품지 마시고 접종 순서가 되는 대로 접종에 응해 주시기 바랍니다.
So what are some important things that you need to know about vaccines as you wait your turn in the inoculation queue? Those with chronic kidney conditions must undergo regular dialysis, even if they were to be infected with COVID-19. vaccines are a must for such patients, given the difficulties in keeping them isolated in quarantine.
투석 환자는 여러 가지 동반 질환을 가지고 있고 또 일주일에 3번 병원에서 투석을 받으셔야 되기 때문에 사회적 거리두기가 어려운 것이 현실입니다. 그리고 코로나19에 감염이 되면 예후가 좋지 않기 때문에 투석 환자는 코로나19 백신 접종의 우선 대상에 이제 포함이 되어야 됩니다. 면역 억제제를 복용 중인 이식 환자 역시 코로나19 감염 후에 불량한 이유를 보이기 때문에 백신 접종이 매우 중요하다고 생각합니다.
The list of eligible vaccine recipients for the second quarter includes people with chronic respiratory conditions and other long-term illnesses who will be inoculated in June. There are also people who are allergic to pollen, fine dust, foods, and animal fur. So is it safe for people with allergies to get vaccinated?
동물털 알레르기 같은 알레르기 질환을 가진 환자가 코로나19 예방접종 금기 대상자는 아닙니다. 그래서 천식이든 비염이든 두드러기든 아토피 피부염, 식품 알레르기 이런 환자들이 금기 대상자는 아니니까 맞으셔도 되고요. 오히려 호흡기 알레르기가 있는 사람들은 코로나 바이러스 감염 때 그 증상이 심해질 수 있거든요. 따라서 이 사람들은 꼭 백신을 맞는 게 좋습니다.
Also, is it possible for vaccine recipients to reschedule their doses if the need arises?
출장을 이유로 먼저 맞을 수는 없습니다. 하지만 아주 필수적이고 불가피한 경우에는 가능합니다. 명령을 받고 출국하는 공무 출장이나 국가를 대표하는 공익적 활동 또는 이제 사회적 파급 효과가 큰 중요한 경제적 활동을 목적으로 하는 경우에는 해당 업무의 주무부처에 요청을 하면 심사를 받을 수 있습니다. 주무부처에서 심사를 한 후에 질병관리청으로 승인 요청을 하게 되면 질병관리청에서 백신 상황을 고려하여 접종 일자를 정해줍니다.
People who are in their 2-week self-isolation period after returning to Korea from abroad can postpone getting their inoculations if it breaches quarantine. Those with travel plans are advised to keep quarantine protocols in mind prior to booking their vaccine appointments in advance. The first and second doses of Pfizer and AstraZeneca vaccines are recommended in intervals of 3 weeks and 10 to 12 weeks respectively. Experts say vaccine recipients must get their follow-up shots within that time frame.
두 번째 백신이 정해진 기간에 안 들어갔을 때는 2차 접종 전에 감염 위험이 증가하고요. 항체가 빨리 없어져서 감염될 위험이 또 높아질 수 있습니다. 그래서 드린 대로 정해진 기간을 지키는 게 좋고 화이자의 경우는 3주 접종이 추천되는데 저희가 6주까지는 2차 접종을 꼭 하는 거를 추천하고요. 만약에 이 범위가 벗어난 경우는 전문가 상담이 꼭 필요합니다.
Take this information to heart to ensure that you don't miss out on your chance to get vaccinated safely and return to your normal lives.
연일 하루 400명대의 환자 발생이 지속되면서 유행이 쉽게 가라앉지 않고 있습니다. 그간 세계 각국의 노력에도 불구하고 코로나19는 다시금 재유행의 양상을 보이며 전 세계의 방역 긴장도가 높아지고 있는 모습입니다.
Fatigue was the most common reported symptom. Persistent symptoms were reported by 1/3 of outpatients with mild disease.
More than 800,000 people here in Korea have received at least the first dose of the COVID-19 vaccine. while reports of long COVID persist among those who have survived their first bout with the coronavirus. Now, for more on this, I have Dr. Alice Tan from Ms. Medi Women's Hospital. Pleasure to have you back, Dr. Tan.
Good afternoon.
And I also have Dr. David Kwak from Sooncheng University Hospital. Good to see you again, Dr. Kwak.
Good afternoon.
Dr. Kwak, let's begin with your assessment of Korea's vaccination efforts thus far.
Well, approximately 800,000 people have been inoculated so far, and that's about 90% of the people originally planned for. And I think it's a very good sign that people who are sort of plan to receive it are agreeing to receive it and have shown to actually have received it. So on the contrary to many other countries who are very showing reluctancy to the vaccinations, I think we're on the right track and we're on a very good start off. The only thing I'm concerned about is that the slow progress of the numbers actually, because we have to eventually cover up to about 600 million people, counting all the population in the country. And we have to, well, our original plan was to cover at least 60% of the whole population, but different studies from all over the world are actually now saying that we might have to cover more than 60%. Actually, in the US, some very renowned scientists are claiming that we might have to cover up to 90%. Which is a lot more than originally we calculated. So we have to sort of speed up the vaccination rate. We cannot just stop at covering, let's say, 30-40% possibly within the year. We have to consider really getting up to speed to really inoculate as many people, almost 100% of the population, hopefully within the year. But to my knowledge, also the original plan also covers only up to about a few millions of people within the first half of the year. And in my personal opinion, that's a bit too slow to my calculation, because if we have to catch up to the speed of to cover the whole population, we have to cover at least 50 to 60% within the half of the year. The speed also matters here because, as we already know, the antibodies that are formed from the vaccinations might not last more than a year. There could be a decrease in the antibody formations. Also, in regards to the variants that are also intruding into the country, if we get ourselves ready much in advance, if we get all of ourselves vaccinated facing the variants, we'll be much prepared, and we'll be, not many people will be able to transmit all those variant viruses. But if only a small percentage of the population is vaccinated and the majority are not immunized or immune against this particular virus, we'll be much more prone to getting the variants affect us in the future as well. So we have to consider the speed now. I think that's our next homework, so to speak.
Right, and affecting the speed, of course, is also the availability of vaccines, right?
Very true.
Right, Dr. Dan, health authorities in the US have found that Pfizer and Moderna vaccines offer 80% protection from the virus after the first dose in real-life settings. Now, this is higher than the 58% efficacy rate that the companies reported after clinical trials. Having said that, what are your thoughts, Dr. Dan, on promoting a single dose of the mRNA vaccine?
Right, so we're looking at, there's an ideal schedule for vaccination. So prime dose schedule within the 3 weeks or 4 weeks that was found in the phase 3 trials. And then we're dealing with real life pandemic scheduling. And so we may have to, if we don't have enough vaccine, then really prioritize who gets the first shot. And whether or not we follow with the ideal schedule of the 3 weeks or 4 weeks of the mRNA vaccines, 8 to 12 weeks of the AstraZeneca vaccine. I think in this case, if we are faced with the need to ration our vaccinations, we're really going to have to look at prioritizing who gets the doses. And our goal is, of course, first to decrease deaths and severe disease due to COVID-19. And the first shot seems to do a pretty good job of that. We don't know how long immunity will last, but we can seriously think about broadening who gets the first shot before we start our rounds of second shots if we are faced with a situation where we have to ration.
And if we have to ration, we have to make a priority. Dr. Dan, do you suppose that we should give this priority to people who are older and more vulnerable to the disease? Or is it the people who are in the working actually right now in society, the younger adults? What are your thoughts on that?
Well, the highest risk of death is in the elderly. So they remain our first priority. And then healthcare workers. In the section before our interview, we talked about the need for people on hemodialysis, chronic kidney disease to get the shot. But we should also think about not just people with chronic kidney disease, chronic lung disease, but chronic heart disease, cancer patients, people with obesity, diabetes. I think these are people who should also get priority over people who are necessarily in the healthy sectors of society.
Right. Dr. Kwak, another interesting finding is that around 20 to 50% of former COVID-19 patients found their long COVID symptoms disappear after vaccination. Could you explain this for us?
Well, I don't think there's a strong scientific background to the findings yet. Many scientists are speculating different hypotheses at the moment. It could be just a timely manner that a lot of people got infected quite a while ago, and it's about time that they are now evading from the symptoms that they had for such a long time. Or it could be that there is actually something scientifically or physiologically happening inside the body that with the vaccination, it's eradicating the symptoms further. One of the hypotheses that caught my mind is that it's a sort of a reboot of the immune system that's done by the vaccination. And I think it's gaining much more academic interest globally at this point, that there's a hypothesis that when a person gets vaccinated, not only through the COVID-19 vaccinations, but through any other vaccination, it sort of reboots our whole body immune system, and it sort of puts it back to ground zero. Of course, plus the immunity against that certain disease. So for those people who were having a chronic symptom after the infection, so these symptoms are actually from immune reactions. This vaccination is putting that back to start off. So that's one hypothesis that I just read that caught my mind. But at this point, there's really no strong scientific ground to all these phenomena that we're seeing. So we have to study further into that.
Right, so we'll have to wait and see then.
Mm-hmm.
Meanwhile, over in the UK, researchers have confirmed a link between COVID-19 and a number of auditory problems ranging from hearing loss to vertigo. For more on this, I have Professor Kevin Munro at the University of Manchester live on the line. Welcome, Professor Munro.
Thank you very much for the invite.
Professor, how common is hearing loss among those former COVID-19 patients, that is?
Yeah, well, the reason we're interested in this topic at all is that we know that some viruses can damage the ear. Measles, mumps, for example. That's why children get the vaccination. And also some adults have a sudden hearing loss. And in some of these cases, we believe it's a virus that's caused it. When the pandemic first started in the UK, a number of people have been emailing me to say they think something has changed with their hearing or their ear. So the very first study we did was to interview individuals who had been hospitalized because of the severity of their COVID-19 symptoms. And when we interviewed about 121 of them, just as part of their routine follow-up and care, about 1 in 10 were saying that they believed that something had changed with their hearing. So more recently, we have conducted a study where we've reviewed all the articles that's been published on this topic, and we identified about 50 or 60 studies that have looked at the relationship between people who have COVID-19 and they're saying something has changed with their hearing. The number, depending on the symptom, varies, but it looks to be, again, around about 1 in 10 of these individuals. We have to be just a little bit careful because the quality of the studies is not always great, and we're still waiting on a definitive study. But right now, perhaps around about 1 in 10 people, for some reason, are saying they believe something has changed with their hearing.
I see. And Professor, based on your study thus far, how do you explain the effect of COVID-19 on our auditory system?
Right. Well, there are a variety of symptoms that people are reporting. Some people are saying that their hearing has changed. It doesn't seem to matter whether these people had relatively mild symptoms, so they were looked after at home, or whether they were severe and admitted to hospital. Doesn't matter if they're young or old. The most common report is a severe change in hearing in one ear. Another symptom, and the most common one, is tinnitus, so noises in our ears or in our head. And tinnitus is often seen as the early sign that there may be some damage occurring within the ear. And then vertigo, when people feel that the environment is spinning, can be attributed to damage to the ear. So it's very interesting to know what could be going wrong with the ear. Is it that the virus could be damaging the ear directly? We cannot be sure about that. The way that the virus enters cells is primarily through this thing called an ACE2 receptor. We're not sure there are too many of these within the sensitive part of the inner ear, but we do know that our immune response, we can have a very strong immune response that can cause a stress reaction. So it might be an indirect consequence of having the virus that's responsible for COVID-19. We also know that it can affect the blood supply, vascular system, clotting. That might explain it. There are a whole number of reasons, and we just have to be a bit cautious right now. In the UK, for example, people are wearing masks. We're not used to wearing masks, and that might be triggering people to think, oh, I do have a hearing problem. When people have a certain amount of stress and anxiety, they often report noises in their ears. So we just have to be a bit careful, and further studies have to be done to clarify the exact numbers and what the cause is for these complaints.
Right, of course. And while we wait for those results, how can these auditory problems associated with COVID-19 be treated at the moment, Professor?
Yes, that's a great question. Actually, we're still at the very early stages, and until we do more studies, it's difficult to answer that question directly. But we are just about this week, in fact, to embark on a study where we're going to compare the hearing of people who are hospitalized because of the severity of COVID-19 with a comparison group of people who are hospitalized but didn't have COVID-19. We have a bespoke hearing research van, so we're going to drive around the country. People will be invited into our van, and we'll do a comprehensive clinical and diagnostic assessment. And that study should tell us more about the prevalence of hearing or ear-related problems. We will get a better measure of the severity of the problems, what part of the ear is being damaged, and then with that information we will be able to advise healthcare, hearing care professionals what sort of tests they should be carrying out and how they're going to be able to manage these people. The one thing I would highlight is there are these reports of people with sudden loss of hearing in one ear. That does happen from time to time, so we don't know if it's coincidental or if it is due to the virus that causes COVID-19, but that is regarded as a medical emergency, and people should be seeking help very promptly. The normal treatment is steroids to reduce inflammation and swelling, so people have to get acted on very quickly.
All right, Professor Monroe, thank you very much for your time and your thoughts at this very early hour at your end.
Thank you for the invite.
Right then, Dr. Dan, the loss of taste and smell appears to be a common symptom of long COVID. How do you explain this phenomenon, and are there ways to treat it?
Unfortunately, there are not a lot of strong answers to your question. And because we don't know the exact cause of the loss of taste and a smell, we can't really direct our treatment that well. There are some theories. First, there was a thought that perhaps the virus invaded the part of the brain that regulates smell and taste. There was some MRI and PET imaging that was done that suggested that, but the research shows that more recently there seems to be damage to the epithelial layer, that's the outermost layer of the nose, and also to a type of cell that supports the nerves that regulate smell. And so treatment thus far has been anti-inflammatory treatment, so a short course of steroids, prednisone, along with a steroid nasal wash. The good news is that 70% of people will recover their loss of smell, loss of taste with time. But for the minority of people for whom this sensation does not come back, unfortunately, we're still looking for a cure.
I see. Dr. Kwak, on the vaccine front, women and those in their 20s are among the largest groups of people to report post-inoculation discomforts. How do you explain this troubling trend?
Well, I would like to mention a couple of different things about that. Number one is the fact that we've inoculated mostly medical personnel in the first phase of vaccination in Korea, and that comprised of many nurses. Especially in the nursing forces, we have a lot of younger nurses who are inoculated at this phase. So when the majority of the composition are younger females, obviously the result will come out as much more younger females in the composition of those who had side effects. Number two is a theory that different exposures to the viral factors for different ages, meaning because this particular vaccination included adenovirus, chimpanzee adenovirus as its vector, meaning the carrying virus that carries this particular codon of COVID-19 structure into our body was a chimpanzee adenovirus. So we're speculating that different people might have had different prior exposure to adenovirus before. We can sort of think that older generations could have had many more chances to have been exposed to adenovirus in their lifetime, as opposed to much younger generations, they would have had much less chance. So that could be what factored into this. But overall, really, I'm personally just being glad that people who've even had the symptoms from the vaccinations were not severe, that they eventually went away within a couple of days. So I can assure people who are to be inoculated in the future, they really don't have to worry too much about this. I would rather say that the side effects that they had from vaccinations were kind of too hyped up by the media, and they were paid too much attention to when it was really taken care with a couple of Tylenol acetaminophen pills, really.
Right. You were vaccinated as well. You received your first dose.
I did receive my first dose, and fortunately, I did not have a single symptom afterwards. I was one of the the fewer people who actually did not have any symptoms at all. But all the people who surrounded me, they had very mild symptoms, such as muscle pains or mild fever. But those were easily taken care of with, as I said, a couple of acetaminophen pills.
Right.
Yeah.
Dr. Dan, what are some post-inoculation symptoms that we need to be wary about?
Well, let's start with the symptoms that require immediate medical attention, and those would be related to severe allergy or anaphylaxis. Usually this is going to happen within 15 to 30 minutes of the shot, and so they will occur more immediately. But basically, if there's any swelling of the mouth or the tongue, a feeling of tightening up of the throat, difficulty breathing, wheezing, lightheadedness, dizziness, these are symptoms that require immediate attention. Also, if there are any symptoms related to blood clots in the lungs or the legs, those would be chest pain, difficulty breathing, swelling of the legs. These would also require immediate attention. We talked about the rare blood clots that might be occurring in the brain and in the abdomen, and those side effects and the symptoms would be severe headache. We call this the worst headache of your life, or a thunderclap headache, a headache that does not go away with rest or with headache medicine. Also, if there's blurred vision, severe abdominal pain, these would be symptoms for which you should seek immediate attention. And then there's a concern of decreased platelets, or these are the blood cells that clot the blood, or if you have increased bleeding. And the side effects to look out for would be bruising away from the site of the injection, or red pinpoint spots, especially in the legs that you would see on the skin. Those would be signs of concern. Otherwise, the side effects that were just mentioned, if you have a mild fever, some fatigue, mild muscle achiness, joint achiness, headache, mild headache, nausea, chills, these will almost always go away in 2 to 3 days. So for these symptoms, the best thing to do is to rest, or take some brand name Tylenol, which is acetaminophen, and just kind of see if they go away after 2 days without rushing to an emergency room or trying to seek medical care, because we are running into a problem of overwhelmed emergency services for people who have very mild symptoms.
Right. Meanwhile, Dr. Kwak, what are your words of advice for those with pre-existing health conditions prior to vaccination?
Right, so as probably have been covered many times already, CDC and KCDC both recommend people to be vaccinated further if they have an underlying conditions. So no one is blocking anyone with underlying diseases to be prevented from receiving the vaccination. One thing to keep in mind though, for everyone who's about to receive the vaccines, they should keep their health status at their best on the day of the vaccine. But if you have a fever, it's best not to receive it and delay it maybe a few days until you're out of the fever. But also other conditions, like if you're feeling too tired, let's say, if you haven't slept, for example, and you're just feeling too tired, you can delay a couple days for the schedule and receive it a couple days later. But I want to reassure that no pre-existing conditions other than pregnancy prevents anyone from receiving the vaccination. So I would urge everyone who are scheduled to receive the inoculation to go ahead. If you're too worried about a certain type of or disease you're having though, we're already here. You have doctors, local doctors, that are able to consult you in regards to that, and especially the ones that are taking care after you with your chronic diseases. Certainly have a consultation with them, discuss the matter, but I'm pretty sure they will eventually also tell you that you have no problem of receiving the vaccination. Number two, for those who are taking, let's say, immune-reducing agents, though, with their chronic diseases, still, the KCDC and CDC still recommends receiving the vaccination. So if you're worried about taking particular medicine, I would mention steroid at this point. Please consult the doctor when or if they should stop taking the medication just a few days prior to being inoculated. So that's one thing to keep in mind. But for everyone who's watching right now, I would strongly urge, even if you have a pre-existing condition, it's okay for you to go ahead and get the vaccines.
Right. Meanwhile, Dr. Tan, how do you explain the recent resurgences across the globe, even amid the rollout of vaccines?
Right. So, you know, when we look globally, we have two sides of the story right now. On the good front, the good news is that new deaths globally continue to decrease. However, the pace of decrease does seem to be slowing down a little bit. But there are warning signs, as you said. Certain countries are seeing upticks. For example, Chile, they had a very strong rollout of vaccination. However, they have recently gone back into lockdown. So despite administering 10 million vaccinations, which is roughly 20% of their population, they were seeing daily new cases of more than 7,000 cases. And that was really causing a stress on their healthcare systems. They had less than 200 ICU beds left, and so they had to go into lockdown. In the UK, they've delivered more than 34 million doses. They recently eased their lockdown measures, but their rolling average of daily new cases is around 5,000 cases. In Israel, of course, they had a very strong rollout. They've fully vaccinated, I think about 56% of their population. Their rolling average of new cases is 480. Now, I should let people know that they have a population of 9 million people. Their population density is 40 times less than South Korea and Seoul. So, what this means is we really need to work on a strong vaccination rollout, but we will also need to continue with all of the distancing and hygiene that we've been doing up until now. We will need to do very strong surveillance as well for new cases and also the variants, because the variants, easing of measures, and increased travel, these are all causes for the upticks.
Right, so vaccinating, testing and tracing still need to go hand in hand then. All right, Dr. Tan, as always, thank you very much for your thoughts. And Dr. Kwak, thank you for being with us today.
Thank you.
Right, the age-old words of wisdom are prevention is better than cure. Accordingly, authorities are calling on members of the public to abide by COVID-19 containment efforts and to support the inoculation campaign. Thank you for watching.